Thanks for joining me for my first episode of White Coat Nutrition. Today I'm going to start off with talking about key nutrients for prostate health, zinc and lycopenes. I'm going to start with a discussion of diagnosing prostate cancer clinically, and then the relationship between zinc levels and prostate cancer. And I'm going to review a study that was done on serum zinc levels in diagnosing prostate cancer. Then we'll take a systematic review and take a look at that and the meta-analysis of zinc and the relationship with bone density. Then we'll also take a look at foods that are high in zinc and why you might not be getting the zinc you think you are from brown rice. And finally, I'll be taking a look at a systematic review and meta-analysis of lycopenes and the risk of prostate cancer. For those of you not familiar with systematic reviews and meta-analyses, it's basically when researchers gather data of all the relevant studies on a topic and put them all together in such a way that they can analyze the data in one large basket. By increasing the sample size this way, the resulting data is more relevant and builds a stronger case for the outcome than if you were looking at one study by itself, which it would be smaller in sample size. And I'll be talking about this more in detail soon. I also want to add that zinc is important for many reasons besides prostate health, such as reproductive health, bone density, digestion, and immunity by helping the production of T cells, assisting in the production of proteins and new cell synthesis. It's also important for insulin synthesis, storage, and release from the pancreas. And it helps you taste your food. And it also helps our metabolism. There are even some studies that show that it helps with our attention span. So let's talk about the diagnosis of prostate cancer. The PSA test alone is not a great test for prostate cancer. And PSA can be elevated for other reasons besides just having prostate cancer, like prostatitis or just age, for instance. In fact, aging does change what we consider the normal range to be. Let's take a look at this chart together. So here's a nice summary. It's a very easy chart to look at. Basically, that just shows normal PSA levels by age. And that's something we take into account when we're looking at the PSA results from a patient's lab work. As you can see, between 40 to 49 years old, your baseline is going to be between 0 to 2.5, and that's considered normal. When you go up 10 years, 50 to 59, you can see how that goes up basically 1 nanogram per milliliter for every 10 years. So by the time you get to 70, you're looking at a normal that can be all the way up to 6.5. And so that's why we call this the gray zone in the 4 to 10 range, because there's a little bit of the unknown there when you're making decisions clinically for a patient to see if they need further testing. For example, a PSA of 4 at age 40 would be something to follow up on with a repeat PSA test, but at age 70 would be considered normal range. Clinically, an enlarged prostate on exam would most likely warrant further investigation. So let's say a new patient to me, age 70, came into the office and he was having a routine yearly physical. He had mild urinary symptoms as well, like a decreased urinary flow. So we checked his PSA and it came back as 10, and he has a mildly enlarged prostate on exam. No family history of cancer, and he's a non-smoker. I would check the urine for an infection with a UA, which is a urinalysis, and done in the office, and I would send that off for culture as well. And the UA is equivocal, so I'm starting what we call empiric antibiotics, meaning that it's probably an infection, so we're just treating it as if it was. I'd repeat the PSA after the course of antibiotics was over, and if it was still elevated, I'd have the lab check a free PSA to total PSA ratio. And if that was low, let's say the free PSA was on the low side, that would be more of a risk for prostate cancer. At the same time, I would go ahead and send that patient to a urologist if that PSA was still around that 10 range. And also that urologist might order that PSA, free PSA to PSA ratio themselves, but I'd have it ordered just in case. And then the urologist would decide at that point if they're going to do a needle biopsy. And keep in mind also that the low free PSA can also be affected by other things such as obesity, smoking, age, and ethnicity. So let's make it more interesting. Let's say we have a 49-year-old man come into the office with symptoms of a urinary tract infection. Prostate is enlarged on exam and the urine shows an infection. If he had a family history and risk factors for prostate cancer, I'd check his urine as well and treat the infection. But I would also check his PSA 2 weeks later once the infection was treated. If this PSA, let's say it was 6, in that gray zone, of course. So I'd be referring to the urologist as well and adding on that free to total PSA ratio at the lab, just to cover the basis, especially because of his risk factors there. Interestingly, when we're talking about that gray zone, there was a study in 2005 in the Asian Journal of Andrology that showed the following. Let's take a look. It showed that measuring zinc serum blood levels improved the detection efficiency when those PSA levels were between the 4 and 10 range, or what I call the gray zone. They compared measuring zinc serum levels to the more commonly checked free PSA versus total PSA ratio and found that zinc levels were actually a better indicator at detecting prostate cancer than that free PSA to total PSA ratio that urologists mainly use to help them diagnose prostate cancer. And in the study, you can see there were 3,940 men over 50 that they looked at. So that's a pretty big sample size there. And there are also other studies out there showing that zinc levels are lower in the tissue of prostate cancer specimens than normal specimens, and other studies that show that zinc inhibits prostate cancer cell growth and invasion, more recent studies than this one. Now let's talk about zinc and bone density. Let's talk about foods that contain zinc. Why is brown rice not giving you the zinc you think you're getting? It's a good source of zinc, but it contains something called phytic acid. And plants store phosphorus in the form of phytic acid. When you eat these foods, the phytic acid or phosphorus forms a bond with the zinc and it gets eliminated from the body without absorption. Other grains like corn, wheat, and oats in raw form also contain similar amounts of phytic acid that interferes with zinc absorption. But interestingly, when these other grains are cooked, they contain less phytic acid, but brown rice retains most of its phytic acid. The reason is the enzyme phytase, which breaks down the phytic acid, is not present in brown rice in significant amounts, while the other foods contain more phytase to break that down. And also sprouting, soaking, or steaming also activates phytase. To help get around this, eating brown rice with protein helps to promote the zinc absorption, especially animal proteins that contain the sulfur-containing amino acids that boost zinc absorption, cysteine and methionine. Also, to improve zinc absorption, taking probiotics will help because they can produce phytase to break down that phytic acid. Other foods high in zinc are foods such as pumpkin seeds at 2.2 milligrams per ounce, oats at 1.3 milligrams of zinc in a half cup, cashews, black beans, crab at 7 milligrams in 3 ounces, which I'm using in my corresponding food video, The Doctored Chef, and oysters, Greek yogurt, chickpeas, lean beef, 5.7 milligrams in 4 ounces. So lastly, let's talk about lycopenes and the risk of prostate cancer by taking a look at this study. Okay, and finally we have this review with the lycopenes and the risk of prostate cancer. This was done in the Medicine Journal, you can see 2015. This review included 26 studies and 17,517 cases of prostate cancer from 563,299 participants. They did find a correlation between increasing lycopenes, and they also found when you did increase lycopenes, you had a decreased risk of prostate cancer. They were only able to find and reach statistical significance when they used the higher quality studies. However, they mentioned one major study they had to get rid of that was not considered high enough quality. And when they got rid of that study, they were definitely able to find that correlation between decreased risk of prostate cancer by increasing lycopenes. They also mentioned a weakness of this study was that there might have been errors because patients filled out questionnaires about how much of the lycopenes they were consuming. They also did not find a correlation between blood levels of lycopenes and incidence of prostate cancer. So after reviewing the studies, this is why I chose the foods I did for prostate health. A 6-ingredient salsa, a zesty pesto panzanella salad because of the tomatoes in both, and then in the second episode, a coconut-crusted crab cake with tropical salsa and a guava orange beurre blanc. And if you know anyone who has prostate issues, I'd appreciate if you'd share this video with them, or also just if they like to eat delicious food. So in part 2, I will be talking about briefly a review of zinc for reproductive health in women, so stay tuned.